And my remarks today will be about what the Federal Reserve brings to the table in terms of promoting healthy communities. To give away my punchline right away, the Federal Reserve's community development function is grounded in a long tradition of fostering and building collaboration. For a variety of reasons, I see this culture of networking as being especially useful in the endeavor of promoting healthy communities. My remarks today represent my own views and are not necessarily those of anyone else in the Federal Reserve System. The Minneapolis Fed's community development activities help support the economic growth of low and moderate income communities in the region we serve. However, we typically do not work directly with these communities. Instead, the bank acts as an intermediary, working in partnership with other organizations to further its goals. Traditionally, our partners have included community development organizations, financial institutions, and government agencies that support economic growth, small business development, and neighborhood stabilization. And when the Robert Wood Johnson Foundation reached out to the Federal Reserve System back in 2010 to address some of the health challenges that low and moderate income communities face, we became acquainted with an entire field of promising new partners, those who work in health and human services. So in this way, the Federal Reserve's community development function is all about networking, it's all about collaboration, and all about partnership building. And I see this tradition as being one that's going to make us especially effective in the promotion of healthy communities. As you all know, and as I think Paul was just talking about, there are many factors that correlate with individual health outcomes. Factors such as education, employment, housing, transportation, and financial access. Because these factors are inextricably linked with one another, successful promotion of health requires comprehensive solutions. And we can only get at these comprehensive solutions by working together across sectors. Now, I think it's easy to come up with to concrete examples of how the Minneapolis Fed's community development function in particular is helping to fill this need. Most prominently, as Paul was talking about in his opening remarks, we helped host a conference last year to promote greater collaboration between community development and health practitioners. In the year since our conference, the Federal Reserve Bank of Minneapolis has continued to engage community leaders across the 9th District in conversations that highlight the need for cross-sector engagement. Now, I should give a little bit of background. So by 9th District, so the United States is divided up into 12 distinct districts that represent different area headquarters for the Federal Reserve System, which is what makes monetary policy and helps supervise institutions and helps run aspects of the payment services. So the 9th District, when I talk about that, I'm talking about Montana, I'm talking about North Dakota and South Dakota, I'm talking about Minnesota, and parts of Michigan and Wisconsin. Okay. So we continue to engage community leaders across the 9th District in conversations that highlight this need that I've been talking about for cross-sector engagement. But let me give you 2 concrete examples of that engagement. So during a recent visit to La Crosse, Wisconsin, so La Crosse is in that little bit of Wisconsin that's actually in the 9th District, Minneapolis Fed community development staff convened a group of nonprofit and local government leaders to discuss anticipated impacts of the Affordable Care Act. While the new health care legislation was viewed as a positive step toward increasing access to care for low-income households, several organizations expressed concern about the increased costs associated with record keeping, the need to reduce staff hours, and the assumed difficulty of retaining part-time employees without employer health benefits. Community leaders agreed that a greater exchange of information between the health sector and other sectors was needed to make informed decisions about organizational operations and to ensure a smooth transition. Now, our community development, to go to the second example, our community development staff also recently traveled to Helena, Montana, and that's where we have the headquarters of the 9th District for the Federal Reserve System is here is in Minneapolis, not here in St. Paul, but in Minneapolis. And but we have a branch office in Helena, Montana as well. And so our community development staff also recently traveled to Helena to learn more about the obstacles limiting access to nutritional foods across that state. In Helena, at a meeting facilitated by the Minneapolis Fed, business, education, local government, and nonprofit leaders discussed the challenges that food suppliers face, which included high fuel and transportation costs, limited storage facilities, and inadequate food processing infrastructure. Community leaders identified potential solutions to address these issues, but you should hear just from the very different nature of these problems that greater collaboration across sectors was needed in order to implement any of these solutions. So that's my main point, that there's a need for cross-sector solutions. And arriving at these solutions will take increased communication among practitioners working on the ground, across sectors, across geographies, and even most challengingly sometimes, across agencies. As you listen to the insights of your colleagues in the room today, I encourage you to contemplate new and unconventional opportunities to build relationships and to share information. Listen not only for those options to assist and build your own projects, but also for those opportunities where your experience can help another community or another organization as well. But I'm talking about the future, but let me be clear that I applaud you for your collaborative efforts to date. And I'm delighted, too, that the Minneapolis Fed's community development function have been able to play such a key role in fostering that kind of collaboration. I'm delighted, but I'm not surprised. After all, as I described earlier, the collaboration is really the essence of the Fed's community development culture. I know that I speak for Dorothy, Ela, and the rest of our group when I say that we very much look forward to leveraging our culture in helping you build the kinds of partnerships and collaborations that we will need in order to promote healthy communities.